Good morning, everyone. Thank you for coming. Like the flyer said, what we're going to be working on today is giving you guys some information about how Parkinson's can affect your swallow, or that's also known in the speech world as dysphagia. So with me are some fellow SLPs just to talk you guys through the process. And at the end, we will answer any questions that you have. All right.
Alrighty. So first, before we discuss the swallow of a patient with Parkinson's, we need to kind of discuss the normal swallow so that we can compare the two. So the goal of a swallow is to be safe and efficient. Safe meaning that we're not aspirating, that there's no dehydration, and that we're maintaining the nutrition that our bodies need. Efficient meaning that our swallow is very smooth, it's not effortful, and it could take anywhere from 1 to 3 seconds. Although a swallow could take anywhere from 1 to 3 seconds, it's typically very fast at about 1/10 of a second. So I'm going to show you a little video here. So what you're seeing here is the preparatory phase. We're getting the food ready to swallow, and this phase of the swallow can take as long as it needs to. This up here coming is the part that's very fast, about 1/10 of a second in a normal swallower. Okay. Okay, so normal swallowing is important to maintain normal nutrition. Males need about 2,500 calories per day, and females need about 22 calories per day to maintain nutrition and weight. An irregular swallowing can lead to prolonged mealtime. If a patient takes longer than 30 minutes to eat their meal, they're going to expend more calories trying to eat the meal than they are gaining from the food itself, which can result in weight loss and becoming malnourished over time. This is something that is pretty typical that we see in Parkinson's patients.
Okay, so Parkinson's and the impacts on the swallow. Parkinson's can impact the swallow at any of the stages. And in that oral preparation of the food, which in the video that Hannah just shared with us, was when you were seeing the food in the mouth and they were chewing and preparing that food to go back for the swallow. With Parkinson's disease, as the central nervous system deteriorates, that can impact the motor control and movement of our muscles. So that could lead to some issues with containing the food or liquid in your mouth, with your lips and your cheeks to contain that. Chewing the food in preparation for the swallow may take a longer period of time. They may not be able to get a complete chewing to combine the food with the saliva in our mouth to be prepared to go back for the swallow. And then there can be difficulty moving the bolus or the yellow. In the video that we watched, that was the yellow liquid that we were seeing in the mouth and watching travel back and down into the esophagus. Another major concern with Parkinson's disease and the impacts on the swallow is going to be the airway protection. There can be a delayed swallow reflex, which is when we see the palate lift and the back of the tongue goes up, and that is going to bring the food over, which pushes the epiglottis to cover our airway so that the food or liquid we're eating doesn't end up in our lungs, but instead is able to travel down the esophagus to the stomach. And poor airway protection can ultimately lead to aspiration, which leads to aspiration pneumonia. And 80% of patients with Parkinson's disease will experience aspiration pneumonia at some point in time across the stages of the disease. And it's important to note that aspiration pneumonia is the number one cause of death in Parkinson's disorder patients. So, with this being said, it's really important that we are identifying these concerns early and starting to implement treatment options sooner rather than later to avoid aspiration pneumonia and hospitalization. Go ahead and go to next. So some common signs and complaints of swallowing impairments that might lead you to realize I need to go see a professional and discuss these issues that I'm experiencing. Those could include having recently lost weight without trying, if you tend to avoid drinking liquids, sensation of food being stuck in the throat. There's a tendency for drool to accumulate, and that is a result of the drool is not being swallowed throughout the day. And so that can start to pool up. And if you notice food collecting around your gum line, tend to cough or choke before, during, or after eating food, that's pretty indicative of a swallowing impairment. And common heartburn and a sore throat can be signs of a swallowing impairment. And trouble keeping the food or liquid in your mouth, again, the strength and of your lips and your cheeks to keep all of that food contained in the mouth. Next one. So if you're experiencing any of these signs of a swallowing impairment, it's extremely important that you set up an appointment and speak to your neurologist about these signs and symptoms that you're experiencing, and they will help you get set up for an evaluation by a speech language pathologist to assess swallowing structures and how they are functioning for you.
So when you come to see us at your speech language evaluation, you can expect to be asked these things. So the first thing we're going to ask you about is your medical history. So please include things like medications, surgeries, or any previous experience with speech therapy. And this helps us to learn about you and any relationships between your past or your environment that could also be affecting what you're having difficulty with. There also might be a physical examination if there hasn't been one done recently by your primary doctor. And this could include a head, neck, and neurologic exam, looking at your gait when you walk, your balance, the sensory and motor functions of your extremities, tendon reflexes, like, the knee, when they hit the knee and your knee jerks up, and a full assessment of the cranial nerves. And what this does is this helps the SLP collect baseline data about your physical function, and this will help us refer you to a different medical professional or talk to your doctor directly if we notice that you're beginning to decline at an abnormal rate. Something that also might be given to you is a cognitive assessment, and you could be given a formal or an informal one. So a formal one would be something like the mini mental state examination and the Montreal cognitive assessment. And don't worry, these aren't intelligence tests or aptitude tests or anything like that. These are just things asking you questions about time and place orientation, your ability to follow commands, and your general attention and alert levels in conversation. So this is helpful because knowing your general cognitive level helps us as the clinician know if we need to adjust anything during our assessment, and helps us make appropriate recommendations for your treatment. One thing that will definitely happen in your speech evaluation is the oral MEC examination. So this is our observation of things such as your lip closure, tongue strength and movement, your jaw strength and movement, your soft palate movement, the part of the back of the throat, your gag reflex, the sensory function, facial symmetry, your voice quality, and your cough strength. This helps us collect baseline data for how your speech and swallow structures work and will inform us for our treatment planning. Now, depending on, your input as the patient, your caregiver's input, your medical records, and the severity of your problems when you come to see us, you may or may not be asked to do a trial swallow. So if it's deemed safe enough, then a trial swallow will include water of different consistencies and different food textures of different consistencies. They're also probably going to be different sizes, and you're going to be asked to swallow those. And you're going to be asked after you swallow to count to 5 or hold like for a few seconds. And this helps us to see if you have a wet sounding voice, which could be a sign that food or liquid are following into your airway. And that is definitely not a good sign. So we want to catch that as early as possible. All right, next. So as we know, Parkinson's is a progressive disease. So depending on your results from the initial evaluation and the severity of your swallowing issues, you might be asked to come back, say in 6 months or a year, to check in on how things are going. Or if your symptoms change and get more serious, to come back then. You might be asked to come in for treatment sessions to go ahead and start treating your issues, or possibly you might be asked to come in for further testing. So, next. So what that further testing tells us, it gives us a better idea of how you swallow, because there's only so much that we can see outside. We need some sort of video imaging to help us see what's going on in and in the side of your throat. So the two most common ones are the flexible endoscopic evaluation of swallowing and a modified barium swallow. So what the flexible endoscopic evaluation is, it's a long flexible tube with a camera at the end, or a laryngoscope, goes into your nose, over your soft palate, and it goes down to be positioned right above your epiglottis, right at the top of your throat, basically. And we're going to look at the motion of the base of your tongue, the pharyngeal walls, or the walls around your throat, the arytenoids, and other features while you're talking and while you're giving us a swallow without any food or water. Then foods and liquids at various consistencies with food dye in them are viewed as they pass through the stages of swallow. The other testing you might be asked to do is called a modified barium swallow. And this is when they take a fluoroscope. It's basically an X-ray camera, and they look at the side of your face and the side of your throat while you swallow. And once again, foods and liquids at various consistencies are treated with barium, and they're viewed through as they pass through the stages of swallow. And the modified just helps us to see what's going on down here during the throat portion of the swallow, to help us make sure that all of the ports are closing appropriately.
And then on this slide, I'm going to talk about treatment. So Parkinson's disease cannot be cured, but some treatment options may include medication or EMST, which is expiratory muscle strength training. And those are exercises used for your respiratory system. So it can strengthen breathing patterns, it can improve your cough and swallowing, and then it also reduces aspiration. A big program that is a good treatment option is LSVT Loud, which is Lee Silverman Voice Treatment. It's a program that shows improvement on loudness and variation of pitch, but secondary improvements include articulation, changes in swallowing, and then also improved facial expressions. So this program is built on exercises that strengthen your voice box and also your speech system. And I just want to include that this is revolved around the patient's real life task. So it's more tailored towards their real life scenarios and real life tasks. And so this program is a one-on-one treatment, and this happens in 1 month. So there's 1 hour sessions. There's 4 sessions per week, 4 weeks in a row. And then also during the treatment, it's a hierarchy level based. And so you start at word level, for week 1. On week 2, you move to phrases. Week 3, you move to paragraph reading. And then the final week, so week 4, you end on conversation level-based scenarios. And then this is once a day on treatment days, and then twice a day on non-treatment days. And so there's daily homework and carryover assignments that are used for the patient to use their loud voice in real life situations outside of the treatment room. So there's 3 key strategies, and the first one is target. So we're wanting to target their vocal loudness and also their positive effects on swallowing. And then the second one is their mode. So how intense the program is how intense we're wanting the patient to work, as in we're needing them to be as motivated as basically the program is. And we're just needing high effort needed from the patient. And then the third one is calibration. And so overall, that's generalization. And the patient is needed to recognize their new, louder voice within the normal limits. So also with this program, it allows the patient to exaggerate speaking and swallowing. And then next.
Okay, so the last thing that we want to emphasize and talk about today is the caregiver's role in playing with someone with Parkinson's disease. So, given all of this information, we can see how a caregiver would be very beneficial in treating somebody with Parkinson's. Um, so the first thing that I wanted to say is that caregivers are needed and valued, especially as this disease progresses. As we know, it is a degenerative disease. So as it does progress, more assistance will be needed in an individual with Parkinson's. So they are needed and caregivers are valued. So as a caregiver of an individual with Parkinson's disease, being educated is super important, and that can look different in a variety of ways. So the broad aspect of it is just knowing the knowledge of this disorder as a whole. So knowing what Parkinson's is, what that looks like, the different stages of it, and then how that will progress. How it progresses overall, and knowing those stages and what symptoms might look like throughout each stage, physically and mentally, and then just the overall effects of it, of how Parkinson's might present itself in the physical aspects of an individual and mentally, and how that can take a toll on mental health as well. And then more individually, we can look at and just knowing what the patient's needs are, specifically to them. And then, things like their medications that they need to take, appointments that they need to go to, and just their overall routine so that they can participate in their activities of daily living. So yeah, so specifically to feeding and swallowing, which is kind of what we've talked about this whole time. We mentioned that they would need extended meal time as the disease progresses and their muscles get weaker. Having more time to eat as it will take them longer. So just giving them and knowing that it might take them longer to eat is super important, and not getting frustrated with them and having patience with them as it does take them longer. Direct feeding is also something that will probably happen depending on how severe and what stage of Parkinson's an individual is. As their muscles get weaker, they will not further be able to feed themselves. So you being prepared and comfortable and familiar with feeding somebody else is going to be something that you experience as well. And then, as I mentioned, it does take them longer to eat. They know that eating is not something that is like it used to be with when they didn't have Parkinson's prior. So they may not like it as much. They may not want to eat. So preparing many meals for them is super important, as they need to maintain as much nutrition as possible. So just being aware of, if they don't eat very much in the morning, preparing more meals throughout the day so that you can give them more opportunities to take in as many calories as they need. Um, Yeah, so overall, some tips for a caregiver taking care of someone with Parkinson's is just the having overall patience and knowing that this individual can't help it, and they know that, and you know that. So just being patient with them and giving them grace in their situation is just really important, and that will help in your guys' experience together. And then making sure that you still take time for yourself, as it is super important um, to take care of someone else that needs it and needs your help. It is really important for you to take care of yourself as well. And then we know that it's a lot to take on taking care of someone with Parkinson's. So asking for help when you need to and when you need it is also something that we want you all to be aware of. So yeah, and I included some resources. So there's a couple of blogs on here that kind of talk about other people's experiences with tips on how to feed somebody with Parkinson's, and then how to help you and to help them overall, and kind of just going over some of the overall tips of that. So yeah, and then there are also some support groups that you can utilize to get, tips and advice from others, as well as Facebook groups, so that you guys know you feel supported. So that kind of wraps up our presentation for today. So we thank you all for taking the time to come and listen to us, and we hope that you've learned a lot and you can take away something. So thank you.